Welcome to page 89 of Anatomy Coloring Book. This is Dr. Stephen Harkins. The peripheral nervous system continued and discussing dermatomes. Dermatomes. Derma means skin and tomes means cut up or like sections. So sections of skin, divided up areas of skin. And so we've discussed how the nerves branch off from the spinal nerve and innervate or supply the skin, organs, glands, muscles, bones, etc. And here is a map. This dermatomes are a map of where those nerves, those spinal nerves, the areas that those spinal nerves innervate or supply. So, or you could think of it in reverse. Instead of a nerve supplying the skin, you could think of it in the efferent manner. You can think of it in terms of afferent too. The sensations coming in from the skin to the body, what spinal nerve do they pass through? So recall that there is a spinal nerve for every level, every vertebra in the body at every level. So there are 7 cervical vertebrae, 12 thoracic vertebrae, and 5 lumbar vertebra. And then there are also 5 sacral segments. And at each one of these levels, above and below the vertebra, there is a spinal nerve exiting from that level and going to innervate or supply or receive information from that area. So the C2 spinal nerve will have branches that come up and innervate the back of the scalp. The C3 nerve will have branches that innervate the back of the neck and the top of the shoulder. The trigeminal nerve, as you recall, a cranial nerve, will come out of the skull and innervate the 3 branches of the trigeminal nerve will innervate the skin of the face. So derma means skin, recall. So we're talking about the sensory afferents nerves. Note that C2 has a spot here right in the middle of the front of the neck that it's innervating. C3 drapes across the front of the shoulder. The C4 nerve, the back of the shoulder there and the side of the shoulder, wrapping around to the front of the shoulder. The thoracic nerves are pretty self-explanatory. T2, just along the area of the ribs, 3, 4, 5, 6, 7, 8, 9, 10, 11. And then wrapping back around the front of the chest, this same nerve here for T2 wraps around. Look at T3, wrapping around to the front of the chest right here. And T4 wrapping around T5, T6, T7, T8, T9. All originating from their designated spinal area in the middle. Exiting out the back and then wrapping around to the front. Same with the cervical. Exiting out the back and wrapping around the front. Those have been pretty simple so far, but look what happens with the cervical nerves, some of the lower cervical nerves. So, which nerves, spinal nerves, innervate the arm? Notice how the C5 area, from the C5 area right here, it innervates this area of the lateral arm. And there's no direct path. So you notice how it's sort of cut off here. C5 and C6, it pinches off. There's no direct path. So it stops innervating. The C5 and C6 don't innervate areas of the neck per se. They escape to innervate more distal areas of the arm. And here's C6 as well. The lateral arm, plus the thumb and forefinger. C7, this middle finger here. Let's go over here for C7, front and back of the middle finger. And this is important when patients come in and tell you, I have pain or I have numbness or pain in my middle finger. You'll relate that to C7, a C7 problem in the neck, for C7, or you'll consider that at least. And on this side here, on the right, excuse me, yes, the right arm, front, the thumb and forefinger of C6, recalling that this nerve travels out through the neck, through the brachial plexus, as we've learned about, not innervating any of these skin areas, but underneath, and then sort of pops up there through other peripheral nerves and innervates this area. Let's make C5 a different color. Since we're already there, the lateral arm, back, lateral arm and part of the shoulder on the front. Now T1, believe it or not, you would think that T1 would simply innervate an area of the rib cage, but it's an exception. Note that T1 actually moves down here, innervates the medial arm, forearm, I should say. This is considered the forearm down here. So that's the lateral forearm, the medial forearm. And then T2, lastly, you see, also escapes and does not innervate per se. Well, it does trace down here and into the medial arm, T2, sort of underneath the armpit, this area here. So the upper cervical vertebra from C1, 2, 3, 4, they sort of stay in the neck and shoulder area, where the C5, C6, C7, T1, and T2 innervate the arm area. So the upper cervical vertebra stay local, whereas the lower cervical vertebra escape to innervate the arm, along with the top two thoracic vertebrae. And it looks like we've got one more to do, C8. Recall that there is a nerve, one more nerve left, C8. There are only 7 cervical vertebrae. 1, 2, 3, 4, 5, 6, 7. And yet there are 8 cervical nerves, because one leaves above C1 and one leaves below C7. So C1, here are the vertebrae, now the nerves. C1, C2, C3, C4, C5, C6, C7, and C8. So that's the tricky thing. Always remember that while there are 7 cervical vertebrae, there are 8 cervical nerves. And C8 is innervated, the innervation of the pinky and the ring finger is a C8 dermatome. So every area I just described is a dermatome. This is the C8 dermatome, the pinky and ring finger. Also note how in the thoracic area, there's a downward sort of slant of the dermatome. So whereas the T12 vertebra might lie, say right here, its dermatome sort of slants downward and winds up way down here at the waist and below. So that includes the thoracic nerves, the trigeminal nerves we mentioned, the 3 branches of the trigeminal nerve innervating the face. Now let's move on to the lumbar nerves. And we'll switch colors. Let's see, let's start with blue here. The L1 nerve. The L1 vertebra lies up in this area here and innervates the sort of the ridge, the top of the hip here, and wraps around the waist into the upper lateral buttock here, and then wraps around to the front of the groin and into the lower abdominal area, the upper groin and lower abdominal area. This is called the inguinal region right here. So L1 goes to the inguinal region. And recall, these are sensory neurons once again. So if you pick a if you pinprick somebody or poke somebody right here, what we're saying is that message of pain will be sent from this area of the arm all the way up to and through the spinal nerve at C6 before it goes up and is interpreted by the brain. And that goes the same for them all. If you take a pinprick, if you have a pinprick to the inguinal region, that message will be sent. It will travel, and here's the back here, through this spinal nerve up the spinal nerve of L1, if you're pricked in sort of this lateral upper hip area, this ridge, and it will travel through the spinal nerve of L1, and before it travels upward, a secondary neuron travels, takes the signal up to the brain for interpretation. Next, L2, in a similar way, slants down as it exits the sort of upper lumbar area, exits down and innervates this area of the lateral buttock and the lateral thigh, the upper lateral thigh area. And here it is over on the front. It wraps around the back here over to the front of the upper thigh. L3. L3 starts out, of course, from the spinal nerve of L3. Innervates a little bit of the back here. Not much. A little sliver. Not much if all, if any at all. If you wanted to test the L3 nerve, you would not test it up in this area. It's too much, it's too difficult, it's too confusing. If you were trying to test that nerve, it escapes out there and then wraps around to the front of the knee. We say L3 to the knee is what we say. If you need help remembering that one. L3 to the knee, the front of the knee anyway, and laterally or medially on the inner portion of knee and thigh. L4 escapes. The spinal nerve is down in this area here, and it does not have any upper or torso innervation. It escapes through the lumbar plexus there and then winds up way down here at the inner lower leg, the inside of the lower leg to the heel. Now, these dermatomes are not precise. They're actually different on everybody, slightly different. This is a general map. If you are a doctor, a therapist, you should know that they're never exact. There's always some variation in the actual human. And L5 escapes down here in this area, low back, and then the innervation is on the lateral lower leg to the medial foot. Somebody might say, oh, I have big toe numbness or pain in my big toe. You would automatically think L5. And here's that lateral leg from the back view, from the posterior view. It wraps around the front of the leg, the lateral leg, the front, big toe. And here it is on the bottom view, the bottom of the foot, the big toe, maybe the first 2 or 3 toes, actually. The plantar surface, that's the bottom of the foot. This is the dorsum of the foot. D for dorsum, meaning the top of the foot. And S1 is the first sacral nerve down in this area here. Escapes there, it goes through the neurons from there, escape through the lumbar or sacral plexus, lumbar plexus, and travel through peripheral nerves all the way down, and then all of a sudden, right down here, the last 2 toes. If somebody says my pinky toe, my little toe, or the bottom of my foot is numb or has pain, you're thinking there's something going on with the S1 nerve, the first sacral nerve up here. And there's a lot of things that can happen in this spine, a lot of masses. We call them space-occupying lesions. Space-occupying lesions, anything that can occupy a space and press on a nerve. That could be a disc, it could be a tumor. So a lot of things, any things that go wrong in the spine won't appear necessarily in the spine. They'll appear as, pain or numbness or coldness or some other sensation somewhere in the limbs, in the legs, or in the arms. Now the back of the thigh is an area of innervation of the S2. That's the second sacral nerve. It's down in this area right here, escaping out and innervating the back of the thigh. There it is right here, S2. Now, the lower S3, S4, S5, the lower sacral nerves, they innervate an area of the perineum. Perineum is your groin area. It's the skin near the anus and the testicular and vaginal areas. The perineum. And it sort of forms a circular area with the sort of like this around the anus and the perineal regions, with the outer regions being, the like S2 and then S3, S4, and as you go in, S5, and it sort of narrows. And that would be and they're very, very close proximity and would be difficult to test because the areas become smaller and increasingly smaller. And so there you have it. There you have the dermatomes of the human body. Derma meaning skin, tomes meaning sort of sections or cut up into sections. And recall that this is the sensory, how your body feels things, the afferent nerves. Afferent. Bringing sensation from the skin into spinal cord and then the signal up to the brain for your body to perceive. Mind you, it's not only pain, but it's also light touch, pressure, temperature, any signal that would come. There you go, pressure, temperature, touch, pain, any sensation that would come from the skin. These little receptors, when we studied the skin, we talked about these little receptors in the skin. Well, they're the ones sending all the signals through these dermatomes, from these dermatomes through the spinal nerves and up to the brain for perception. Another thing to note is that while there is a nerve, a C1 nerve, exiting above C1, it is interesting and crucial to note that there is no dermatome for C1. C1 does not have a sensory root to it. So look down here, C1 has no dermatome, has no sensory root. So it's only motor. It only goes to muscles. So this little top nerve up here at C1 does not go to any skin area. There's no C1 dermatome. And this concludes the lesson on dermatomes. I'm Dr. Stephen Harkins. Until the next lesson. Actually, we forgot one little diagram down here. Let's see. This is the spinal cord. Of course, here's your posterior horn. Here's your anterior horn up here. And this diagram shows how there could be overlap from the skin and the dermatome. So this is the C4 innervation, or the C4 spinal nerve. Right, that's the root, spinal nerve, and that's the nerve root. And you see the information coming inward to the spinal cord. And of course, as you know, it's a sensory nerve, so the information will come into the lateral horn here, or excuse me, the posterior horn, the dorsal horn. And this diagram is showing overlap. Look how a branch of the C4 neurons might overlap with the branches of the C5. So you could see how perception going inward might get a little difficult. So if there's a pinprick right here in this area of overlap, there might be some confusion as to whether this pinprick, or say they have numbness in this area, there might be confusion as to whether that's coming from the C4 or the C5 dermatome. Or let's say there is a sensation right here of pain or of numbness in your patient. You might have difficulty discerning whether that's coming from the C5 or the C6 area. So there is some overlap of dermatomes. Okay, now this concludes the lesson, page 89, Anatomy Coloring Book, Dermatomes. I'm Dr. Stephen Harkins.